Welcome to the Auburn Medical Group YouTube live stream, the entertaining medical live stream where viewers can ask real-time questions of real medical doctors. And here are our hosts, Dr. Mark Vaughn and Dr. Gwen Vaughn.
And it's Dr. Vaughn and an absent empty chair because Dr. Gwen is out this week. He'll be back next week, and he misses you all so much. But he has a life outside of this show. Imagine that. Today, we're talking about possibly a real aphrodisiac. Kisspeptin is the name of it. And its purpose is to treat hypoactive sexual desire disorder, which is a real thing and does cause a lot of distress to the people who, just absolutely cannot get interested, which is a problem if, in example, in a couple, and one of them is really into sex and the other one is not. That can be a problem. That can be distressing. That can cause relationship difficulties. So this is a real thing. It's not lust for kicks. This is something that actually matters to some people. So it affects 8% of men, 10% of women. Now, if you think about it, 8%, 10%, it's not that far off. If matchmaker, make me a match was doing her job, then it wouldn't be all that distressing to many people. But it is distressing to the people who have it. And so we're going to talk about how do you help desire, which that would be an aphrodisiac. So we'll talk about real ones. We'll mention the name of a fake one later on. There's lots of things that are sold, and there's lots of things that cause destruction of wonderful animals, some of them endangered species. There's things like the bear gallbladder and the rhino horn, and there's some others, things that people are doing terrible things to get from animals that don't necessarily help for this. And it's not people who don't have the desire that are using it. So this is not medical application in those cases, but we're talking actual real medical studies done in different ways of measuring whether or not it works. We'll get into that. So we're not going to answer questions and comments that come in, although Jennifer, I do want to know that they're coming.
Okay.
Oh, you're not seeing that. That's because I didn't set it up. I'm going to, though, because we so much want to have that when it's time. You know what? I'm not. And the reason is because it takes so much time to do it, and I don't want to take away from the show. But we're going to talk about the subjects. We're going to talk specifically about testosterone, kind of the first original thing to think of when we're talking about something that helps to enhance interest in sex and actually is ministered to both men and women for that purpose. Let me get you the thing here so you can just see the wonderful comments as they're coming through without causing a lot of sound here. So we'll just have you read comments, although not yet. We will get to them. I'm very happy to see that already you have Lindsay Antoine giving the comments. So I'm super, super happy about that. You have your mic on for when the time comes.
I do.
So we'll jump right into the subject because people like us jumping into the subject first and getting the comments later. Testosterone. Believe it or not, even though testosterone is natural, giving it as a medicine is a bad thing and results in a lot of problems. And it's a little counterproductive if it's being given to enhance the sex life of the patient. For example, when it's been given to women specifically, causing side effects of acne and hair growth and nausea and swelling. It's hard on the liver. You have to watch liver enzymes. It has to be given through the skin or through an IM injection, because if it's given orally, it goes through something called first pass metabolism, which is, we'll use our model here, as soon as it gets into the stomach, the next place it goes is the liver, because it gets absorbed by I'm trying to think if testosterone gets absorbed in the stomach or in the intestines. Either way, it gets into what we call the portal circulation, which goes straight to the liver from where it gets absorbed, straight to the liver, and then gets cleared so that the amount that comes out the other end after the clearance in the liver is a fraction of what the person took. But the liver is the part of the body that gets hurt by it. Other parts are the ones needing it. So you can't give it by mouth. In fact, that's illegal in the United States. And in fact, it's not even FDA approved to be given for women for enhancing sexual desire. So There's some other things that have been FDA approved. One of them's called, I'm not sure how to pronounce it. It's Addyi, Addyi, I guess. It's taken daily as a pill orally. It costs $543 a month, for a 30-day supply. It's sedating, and it has black box warnings, actually 3 different ones that have to do with liver processing of things. Imagine if it's, going to work kind of like testosterone. And I don't know that it actually works like testosterone. I just know that it has the same problems with the liver, with interrupting liver enzymes. You can't drink with it. Just not a good alternative. And then there's one called Vyleesi. Now, Vyleesi came along, and it's an injection that you take when you need it. Its effect lasts for about 24 hours, so you don't have to, like Viagra, sit there with a watch and say, okay, it's going to wear off within a few hours, and it's going to start working in the next 30 to 40 minutes. No, it's not like that. It's more like the Cialis in that it, for a different purpose, but the timing of it. Vyleesi was approved in 2019, and I'm going to read you a quote. I didn't put this up for you to read, or is there a Vyleesi quote? Let me see if there's a slide. No, the Vyleesi, it's the price. Go ahead and show them the price. Go ahead and put that up. No, the price. There we go. You can see that it's over $3,000 for 4 injections, $750 per get together, we'll say. That's a lot of money for something but maybe for some people it's worth it. Most people don't have that kind of money to spend. I don't think most people watch this show do, certainly. So in trials, about 25% of patients treated with Vyleesi had an increase of 1.2 or more. I guess that's how they measure, I don't know, 1.2 what, but 1.2 or more in their sexual desire score. Oh, that's what it was. The scores range from 1.2 to 6.0, with higher scores indicating greater sexual desire compared to about 17% of those who took placebo. So let me point out what it says here. 25% had an increase with Vyleesi. 17% had an increase just with a placebo. So that's an 8% increase over placebo. 8%. 8% of the people who used it got the benefit it's supposed to give, and they're charging, how much did we say? $3,000 for 4? Here's another piece of information. About 40% of patients in the clinical trials experienced nausea. 40% compared to 8%. So you're 5 times more likely to get nauseated by it than for it to help you be more in the mood for sex. These are not really good alternatives. So, there's not a real good answer. So now we're at a place where we have this thing called Kisspeptin. Kisspeptin is a neuropeptide that stimulates in the brain, and a lot of the literature I read on it was from before it was being used as, we'll say, aphrodisiac. I know that the people who are researching it probably would not like me to call it that, nor the people who are actually, it's not being prescribed yet because it's not FDA approved yet, but normally, I shouldn't say normally, its role that we've studied the most is in the development of sexual maturation. And there's people who have problems with being infertile. And it looks like this may be key to correcting that problem by releasing the right hormones from the brain to stimulate the gonads to do their job and other sexual organs. Some people who never even go through puberty, it looks like either Kisspectin not being there, or receptors not recognizing it, or not being able to act when it's supposed to be stimulating parts of the brain. So Kisspectin is used there. It also looks like its administration through an IV enhances sexual desire. So how do you measure such a thing? How do you measure such a thing? I'll tell you how they did it. I'm glad you asked. So they have pictures of men's faces. And they found that they had the subjects be their own controls. So they would look at these faces when they take a placebo, and another time when they're taking the Kisspectin, and they would have different people in different groups where they'd have the placebo first, and then next time they come back, they'll have the actual Kisspectin infusion, 75-minute infusion. So you're getting this mess for 75 minutes. Then you look at pictures of men's faces. They also had them watch what they call erotic videos. So they responded more positively to the faces, I guess, in a sexually desirable way when they had the Kisspectin compared to placebo. So why don't we show the video and see what they think? Was it because, yeah, go ahead and play it. Because they had Dr. Mark as the picture when they had the Kisspectin and Dr. Gawain when they had the placebo? Probably not, but that could explain if it didn't actually work. And then as far as the videos, they weren't Auburn Medical Group YouTube videos that they were showing them to see if they would get interested in sex or sexually excited or turn on when they would score. Let me show you what the scores look like, though. There's these graphs, and this type of graphing is not used all that often. This one was for, this one you actually wanted the score to go down. You want it to be less negative. Well, I guess that would actually be more positive, wouldn't it? So they have two sides to this graph, and one side is a placebo. Let's see if I can point to it here. One side's a placebo, one side's the Kisspectin. Kisspectin, placebo. Placebo, Kisspectin. So some people started with Kisspectin and then had placebo. Other people started with placebo and then had Kisspectin. They have different colors of the lines. There's a little key over there on the right side. It's a mirror image to me.
You're on the right.
Yeah, that's right. So they mix them up, and what you're supposed to see on the graph is that they go up from the placebo side to the Kisspectin side. And you see that. There is a difference in that direction overall if you kind of squint and turn your head sideways and look at it. Let's show them what the other graphs look like. Same thing here. You want them to be going from lower on the left to higher on the right. And they did when they're measuring different things, like the response to pictures of men's faces, to erotic videos, to, I'm trying to remember what the other thing was they tested on. I think it was a questionnaire that they asked them about how inclined they were toward being interested in sex. Yeah, I think one was a questionnaire. Response to pictures, response to videos. There was others, but I don't recall exactly what. Overall, though, you see that there's a little bit of trend. Now, if you're like me, you look at this and you look at the data from the previous study and think, if I was to spend a lot of money on something and risk some side effects, I'd really want a much more sure response of it working than what we're seeing here. That's my take on it. That yes, they're able to prove that with statistical analysis, more people than not had the desired result. But I don't know that that's necessarily really convincing me that if I was in their shoes, that I would want to go through what's necessary to do this. A 75-minute IV infusion per time. That's currently what Kisspectin therapy would be by this study. Maybe somebody else will do a study and be able to get it, I don't know, maybe in an oral form or a patch or something that's done daily instead of a 75-minute IV infusion. We don't know. Also, one of the things, sorry, I keep pointing in the wrong direction. One of the things that they measured was functional MRI readout for blood oxygen level dependent activity, which would be blood going to certain parts of the brain that are associated with interest in sex. So kind of a surrogate for them being interested or having a response that we're looking for with essentially an aphrodisiac. So should we, let's ask our viewers.
All right.
We'll go through their questions too, but before we start in your questions, I want you to tell me, do you want me to sing the Kisspectin song? You tell me, because then I can say you asked for it. All right, so what do we have for comments and questions?
Well, the first question was who's going to sing the song. Let's see.
What, already?
Yes, is who will sing the song.
I just asked.
That was earlier, though.
It would be me. Dr. Gawain's not here,
It
so.
popped up before you even before you did that.
Did they see the guitar?
Tasmania.
Oh my goodness.
Yeah, hi from Tasmania. That's pretty impressive. And then these are pretty good. It says, wouldn't it be great if the human body would just function in a healthy manner? What a concept.
And it does for 92 and 90%.
And then we've got what we need is a Men of Auburn Medical Group calendar. That's what we need.
The Doctors of Auburn Medical Group calendar, which I keep trying to get Dr. Gawain to participate. And would you be the photographer?
Sure.
I keep trying to get it together. I thought we were going to do the January picture in January. We'd be wearing lab coats. But I can't get Dr. Gawain to totally go for it. Sorry.
He's a stick in the mud, huh? Stick, huh?
I'm working on it. Yes, I think that's what they had them look at was the Doctors of Auburn Medical Group calendar. Okay.
Okay. And then the last one just says, sing a song, sing it long.
Actually, I took out the extra choruses, which you like the line. I'm going to interrupt it the same way I did when I did for you. Okay. Got to drink my liquid courage to get me to. Thank you for the Dutch Brothers, by the way, those of you who are part of Patreon, and Lindsay Antoine. Okay. Although you're not supposed to drink coffee before you sing.
Yeah?
No.
Good to know.
No. Okay. Here we go. And those of you who are keeping score, you will notice that this is a different guitar from last time. We are plugged in. It's so wonderful when your children take music lessons, because then you've got these instruments laying around that you can just take out of the closet and okay.
Here we go.
All right, I'm gonna turn off your mic temporarily, but they'll still be able to hear me sing. All right, are we on the singing camera?
Mm-hmm.
Oh, we are. Okay. I thought this was higher in that view. Try the Gawain camera and see what happens. There we go. So now they can see because I know when I watch people playing music, I appreciate being able to see the pick, the fingers on the fretboard or keyboard or drums or whatever it is they're playing. Okay. Jennifer knows why I'm acting like this, because she heard me rehearse it. I think every time that it was rehearsed. Maybe I did a couple times before you came in. But okay, the Kisspeptin Song. Oh, what a way to start. There's a hormone that you need to know. Kisspeptin is the star of the show. It's not what you're expecting when you're getting your infusion. Can it achieve the passion worth choosing? Kisspeptin. Oh, Kisspeptin. Superior to horny goat weed. Okay, horny goat weed. Horny goat weed. I actually had to treat a patient for this in the emergency department once. Horrible thing for the poor patient. Her boyfriend bought this packet of powder in a gas station called horny goat weed and had her drink it for the purpose of what we're talking about here. And it was a stimulant, because some pharmacologic genius thought that, just a CNS stimulant will make you more interested in sexual activity. No. It also causes rapid heart rate, caused her to go into an arrhythmia. Not cool. So, no, horny goat weed is, just don't. Okay, let's get on to the second verse. That was my way of getting out of making it short. All right. It regulates the hormones in your brain and sets the mood for love to reign. It's a natural way to feel the desire. To light the spark and set the fire. So forget about those potions. They're all just hype. Kisspectin is the hormone that ignites. It's the key to passion that's true. And it's all inside of you.
Very nice.
I did it again. All right, that was for you. Okay, let's switch back to the other two.
Alrighty. And
All right, so we can take questions
say, as of
or
now,
comments or super chats.
we did get one with a
yes.
super chat from Lindsay and Twine.
Thank
She
you,
said,
Lindsay.
every song we get, I send a super chat.
Oh my goodness! Thank you. That does encourage me.
And we haven't gotten any questions yet.
And even just attempting today's song with the help of Chat GPT, although it needed a lot of help on this one. This was one of like 3 or 4 different times I had it run to make the song, and this is the one that came out the best, and I still had to modify it. So that's Kisspectin. I'm not super hopeful for it based on what we know so far and what its predecessors have been, but know that there are actual real aphrodisiacs, some of them FDA approved, that are out there, intended for serious distress that patients have because of a mismatch between them and their partner. And we will be back next week with a show with Dr. Green. Any other last comments or?
We do not as of now.
Okay. All right. So thank you for watching. Until next time, Jennifer and myself telling you to stay in good health.
Doctors, thank you for another informative session. Auburn Medical Group is located in Auburn, California, USA. Thank you for participating. Please tell a friend and join us again next week.